Hey, everybody. It is my pleasure, and I hope everybody is well. And thank you very much for tuning in to my live stream with John Jones yesterday and Derek Sue. It's my pleasure to introduce for the first time Dr. Noha Abolata. She is the CEO of Roots Community Health Clinic. And Doctor, welcome. How are you doing?
I'm doing well. Thank you so much for having me.
Yeah, absolutely. And I'm gonna let my hair down a little bit because we were talking backstage. But Doctor, I want to congratulate you on all the great work you're doing, and really, start off by giving a quick introduction to folks about you, and then I'll let you take it from there. But this is Doctor is the founder of the Roots Community Health Center, and she's devoted her career to eliminating health disparities and improving the health of marginalized communities. Through Roots, founded in East Oakland, she has pioneered the delivery of culturally responsive whole health and championed the integration of physical and behavioral health care, workforce enterprise, health navigation, and mobile medical services to address the needs of over 10,000 members. She's overseen Roots' growth from a two-person volunteer effort to a multi-campus, multi-county nonprofit with over 175 staff. Dr. Aboelata serves on the board of governors of the Alameda Alliance for Health and is the immediate past chair of the Alameda Health System Board of Trustees, and is and prior to Roots, she, an Oakland native, served in senior executive roles for Tiburcio Vasquez Health Center, the Native American Health Center in Oakland as well, and expanded publicly funded primary care services throughout the Bay Area. And I'm going to stop it right there because I could spend the rest of this lovely meeting, extolling your virtues. But Doctor, for you, where are we in Oakland, and discuss more about Roots' mission in the middle of a pandemic, which nobody anticipated, 2 years ago, right?
Right. Well, Roots' mission, I think, is a little different than a lot of maybe healthcare entities in the sense that it is to uplift those who've been impacted by systemic inequity and poverty. So in a lot of ways, we were sort of, as much as one could be, I think we were in a good position to be able to quickly kind of respond to the crisis because we've always been sort of at that ground level, anticipating what's coming next and how our community might be impacted by it. And so this was no different in that sense, that we kind of stay ready in a way. And we just sprung into action really quickly when the crisis hit, and have really tried to stay kind of at the leading edge of the issues that we see kind of heading our way.
What are some of those issues that you see heading your way? Curious.
Oh, well, so I mean, there are a number of them. I could talk about just the virus. I could talk about just the vaccine. I could talk about our overall community. So I'm happy to delve in further. But I would say, as it relates to just the overall situation and just the uncertainty of what the coming months will hold, I would say we're just kind of, I guess I've learned to not, get too comfortable in the last 10 months because things are changing so quickly. As it relates to the virus itself, I think the biggest concern that we all should probably have is around variants and how quickly we'll know if we have one that is somehow avoiding the vaccines or the tests or the monoclonal antibodies, because that's a real thing. We haven't identified those yet, but we're sequencing such a small percentage of samples right now, like less than 1%. So I'm very concerned that we'll be caught sort of off guard, and I don't think we should be, because we know there's certain things we know, just like it felt a little like we were caught off guard with the wintertime spike, even though we all knew it was coming, right? But it still felt, I think, because you can't predict anything, can't predict how big it's going to be, how severe it's going to be. So we just have to stay really on our toes and do our best to plan as much ahead as we can, in the situation. Certainly with the vaccines, we're concerned about uptake, and then just big picture wise, moratoria are going to end. Evictions will pick back up. Biggest thing we're working on before the pandemic was displacement. So we're worried that that's going to come back with more, ferocity after things start to be, to expire, so to speak.
Hey, doctor, help me with something. It concerns me and I want your take on this. It's not entirely a diversion, but does it bother you that no one really knows where this virus came from and no one really knows how these variants or these mutations are occurring?
Well, so I wouldn't say we don't know how the mutations are occurring because viruses mutate. That's what they do. And so the mutations are not unexpected at all. I think what is concerning is, how quickly it's happening. And that's really a function of how much infection there is. So with every replication cycle, there's an opportunity for a mistake. Just like if you're typing something over and over and over and over again, you're going to make some mistakes. And viruses, that happens when they're replicating. So we expect mutations. The majority of mutations don't have any impact, but there will be some that do, that make the virus more fit, and that's what we're seeing with the South African variant, with the Brazil, with the UK. It's making the virus more infectious, essentially more contagious. Actually COVID doesn't mutate that fast compared to like the regular flu, which we know mutates very quickly. In fact, we can't ever keep up with it, really. We do our best to get to vaccine, but it takes a lot of work to try to predict what strain we're going to be dealing with, because that one mutates actually quite a bit faster. So to the point about mutating, I think none of us are surprised about it. I just don't think we have an infrastructure set up in this country to deal with anything on this scale, like nothing, not even close. Far as like where it came from and all that, I mean, I think some things we just never really know what happened. I think there's some pretty decent theories about it. And then there's a lot of politics and a lot of confusion and a lot of distractions. And at some point, well, at this point, in some way, it doesn't matter now. I mean, it does if we want to prevent these things from happening in the future, or have a better line of sight as to like what could we have done differently. I think it's always important to know, but we're still in the thick of just dealing with the ramifications of it. And so on some level, this is what we're dealing with now, regardless of where it came from.
If you had to give both the city of Oakland and the county of Alameda a grade in handling this right now to this date, what would that grade be and why?
Oh, it's really hard to do that without setting the context of a lack of a national strategy, which is an abomination, right? So, I mean, and so on some level, what you have is jurisdictions being left to do the best they can with what they have. I will say the city of Oakland moved very quickly. And that is something that, that impressed me, in the sense they were the first ones to come down to roots, like, hey, how can we support you to do, testing and that kind of thing. And it was a lot more of just being creative, right? Being innovative, being able to say, yeah, we don't have it all figured out. We don't have everything we need, but we do have this partner. We do know them over there, and we know roots, and we know this, and we know that. And really just almost matchmaking. They introduced us very early on to CORE, which is like a global disaster relief nonprofit. And we partnered, we clicked up immediately. They did all these just crash kind of like trainings with our staff. Like we had like COVID boot camp, out in our parking lot, helped us set up a big old MASH unit. And that was really, the city's kind of trying to pull these pieces together, and they also popped up that testing site at the Henry J. Kaiser. And so I do think that the city acted really quickly on a number of things that I think, on some level, the city doesn't have a health department. So this is not even in their wheelhouse or in their what's required of them.
That's a great point. Yeah.
So, so I was impressed with the mobilization, I would say, and the creativity early on, and really treating it like an emergency, right off the bat. So I was actually pleasantly surprised around that.
And where, with respect to that conversation, what initiatives are you all involved in now? And also, if I'm not mistaken, there's a fundraising effort you have going on right now too. Am I not wrong?
Yes, we do have. Yes, thanks for asking. I was going to forget about that. The horrible CEO. So yeah, and actually that's a city partnership too, which was an interesting one, which was, the city calls them the community cabin sites. And those are the sheds that unsheltered people are invited to move into from an encampment. As you probably know, they were very controversial and probably remain, controversial in some ways. And it was a tough decision. I think when Roots was first approached by the city, is this something we would want to do? And, there's a number of reasons why we had concerns about it, in terms of what our real strengths are, in working with the community. But the real, I'll be perfectly transparent. The real decision within our organization to move forward was from the urging of our street medicine team, who goes out to the encampments and provides medical care to people living in the encampments. And they just said, I'm tired of our patients dying on the street. I would rather have them in something. It's clean, it's safe, it's secure. People are not being assaulted, raped, all that. There's food provided. So there's a lot of challenges with it, and a lot of things that we lifted up to the city leadership around what we wanted to see look different for our site, simply because, again, I think Roots as an organization is very unique, and a big part of what we do is, really helping people to become less reliant on these systems and actually be able to move forward in life in a way that, where they're achieving their goals and they're able to be self-sufficient. And so what we wanted to do and what we sort of pitched to the city was that we would like to make our site all for people who are ready, willing, and able to work. And so we made that shift on January 1st, and that's what the fundraising campaign is about, because we're really working to create a fund that can be matching for people's savings when they leave. That is our goal. Right now, we're able to get a lot of different types of funds, weave together to help people. But really, our goal is to make sure people are fully employed and able to get to work. So you still have to be literally homeless to qualify to live there. But it really is about kind of wrapping around folks like we always do, but with a real focus on, we understand that this individual's path to self-sufficiency will be work. And that is not the case for all the people living in the encampments of Oakland, right? It's a percentage, some percentage. We want to be there for that group in particular, because we know we're good at that. We know we do a very good job in getting people to a place where they're self-sufficient and making it on their own. And so we want to put all of our energy and effort and skills behind each and every one of those residents.
You're talking about like the Turning Point fundraiser. Would you like me to play the video?
Hey, why not? Thank you.
Yeah.
Roots has been in Oakland since 2008, and what we've seen evolve over the years is really just a multiplying of the number of unsheltered people on the streets of Oakland. And so we were presented with the opportunity to run the site at East 15th and Miller. The city approached us and asked us if we would be interested and able to run it. And it really took a lot of actual soul searching within our organization as to whether this was going to be a good fit for Roots, because really the only housing we had done prior to that was just connected to our apprenticeship. So people who are ready, willing, and able to work.
And yeah, so congratulations on that. That's the Turning Point fundraiser, right?
Yes, sir.
Is there a place down here where one can donate? I'm looking down here.
Yes. So you can click there, and then up at the top as well, there's the donate button. Yeah. And there's sort of a whole series of yes. There you go. Keep going.
It went right to my PayPal account. There's certain things I don't want people to see. I'll get there. But hey, so you have the tough sheds, which I've never been an objection to, because I always felt that there needed to be micro housing, in order to help solve the problem. But what is it? I'm just gonna ask you a really brass tacks question. Why is it? I'll be 59 this year, and what really swims through my brain is that when I was 9 years old, we used to call people on the street hobos, and they weren't common. If you saw them, it wasn't, they weren't there long. Maybe they were between families or whatever. But the point I'm making is that their position was temporary, was temporal. And now it's as if we've allowed society has allowed homelessness to be a permanent class of people. Where did we go wrong?
It's a hard one. I mean, I'm born and raised in Oakland, and so I also recall it was like People's Park, maybe San Francisco, but Oakland. I mean, we went through a whole crack epidemic and really didn't have, this level of people being unsheltered. And I think it is not a simple answer. I actually think that there are many, many factors that play into this. But one of the biggest failures, probably, of our national, I would say, approach is to mental health. And I would say that we do not have a good strategy for caring for people with mental health challenges. And that was the bulk of unsheltered people when we first started street medicine, maybe 2014, 2015. That was probably the larger percentage would be folks with mental health challenges and substance use. And sometimes it's hard to tell what came first in terms of the different, issues. But we really don't have a good system of any kind, right? We this country's history as it relates to how we address mental health is not pretty at all. And it continues to be not pretty. And it's probably just as ugly now as it's ever been, in the sense that most mental health, the largest mental health establishments in the country are prisons, and county jails, and this is true just across the country, right? So we have a failing there that I think is almost impossible to sort of not have that conversation when you're talking about unsheltered folks. I think you then have just the economic pressures and the cost of housing, and the really sort of the inability to be able to keep a roof over your head, even if you're, say, making minimum wage, right? In the Bay Area, that means a lot of things have to be lining up for you, but you're probably commuting a lot. And the car breaks down, then there's that. So I just think that it's just, the cost of living and the way that, residential real estate is not necessarily sort of part of a basic expectation really anymore. If you work and live in this country, it's not really an expectation that you can afford to have a roof over your head. There's something very wrong with that, right? So I'm not an economics expert. I don't pretend I know the solution to this, but I know that a roof over your head as a primary residence should not be like a commodity that has no end in sight to how much it is with comparison to how much you can make living in that or working in that area. So there needs to be some congruency there. And it seems to me that there is absolutely no control when it comes to any of that. So that's kind of like the basic problem. And then you have sort of our ending mass incarceration, right? Where, that definitely coincided with our ending mass incarceration definitely coincided with numbers going up. And we certainly saw that at Roots, where we work with a lot of people that are coming home. And, back 5-7 years ago, it was a small percentage of people coming out who were becoming immediately or imminently homeless. And now it is the lion's share. Wow. And so people are not able to, sustain or obtain housing. And so it becomes like a whole other vicious cycle. And so, one of the observations that we made over the years, as I mentioned, is that early on, it really was mostly people with more severe mental health challenges. And so for them, the path towards self-sustainability will probably be to get them as stable as possible, on disability and into permanent supportive housing or some type of subsidized housing. But as we saw the numbers of people who were not going to qualify for disability increase, what is the solution for them? And we feel that is a huge gap, that nobody's actually figuring out a solution really for that group of people who's not actually disabled and so forth. So that's kind of where we came in with, okay, well, people need hope, they need opportunity, they need a roof over their head while they're in training, and then they need a job, and then they need to get a place. So it's not really complicated or anything. It's just that it's very hard to put that together, because there is no one, I would say, or no even sector that's really focused that way.
Help me with this, because it seems to me, I was talking with someone about this the other day, that I'll clean it up a bit, not in terms of language, but in terms of politics, having nothing to do with elected officials, just our system. It seems like our system doesn't want people to have money. It almost just seems as if it's like it makes it really hard to make money. And then if you look at the current situation with people being indicted, and basically those people are really, really rich, it seems like one quarter of the time it's because they did something untoward. How can we change the system so that we get people a guaranteed minimum standard of income? I know it's a conversation, right? And some of the Nixon administration came up with a 72, but didn't do it because they thought that they would be mistaken as helping black folks to, which is nothing wrong with, but that's how crazy they were. At any rate, where are we in a society, and how do we get to a society where it seems like we're manufacturing poor people, and then we seem to want them not so much by desire, but by inaction collectively to stay that way? Or am I wrong? If I'm wrong, I'm happy to be wrong.
In some ways just above my pay grade. In the sense that, for me, if we're saying that there's such a congruency that you cannot possibly live in Oakland, or you cannot possibly make minimum wage in Oakland and live in a 50-mile radius of here, right? That is the incongruency that I don't understand. So to me, there has to be a place where we think that, okay, people have a right to if you're and then you start to get into, well, what if you're not working, and right to housing and that kind of thing. So I'm not even talking about any of that. I'm just saying, even the basic, if you're working minimum wage, can you even afford to live there? There's something wrong there. So I think about it a lot like the Affordable Care Act, right? Where, I will just unapologetically say that was a game changer for medicine. It was a game changer for all kinds of people. And, it really has sort of transformed in terms of the way of thinking, okay, this is a basic right. Every American person every person who lives in the United States should be able to access healthcare. Even if we have to subsidize it for some people, right? And so for me, I don't see why housing can't be a similar situation, where we basically say, okay, we've got to, to me, it's almost a values thing, where it's almost like at some point at the federal level, our values have to dictate that we should not have people living on the street. And then at that point, I think you can start to change some of the other pieces, because I think honestly in Oakland, it's heartbreaking to me. The majority of people now, there was a time when a lot of people were coming over from San Francisco. We've all seen that, right? But the majority of people are from Oakland, have roots in Oakland, but there are cities with no tolerance, and Oakland is not one of them. And so, there are cities where you have, two choices, basically: move along or go to jail. We don't have that here. And so, so it is kind of, you kind of cannot, my opinion, right? You cannot look at this by a city, by a county. You really have to look at it very regionally, which is why, this pandemic has been very interesting, right? Because I was talking about all this regionally homeless crisis stuff. Can we declare it a public health crisis, right? Can we declare homelessness a public health crisis in the broader Bay Area? Because it is, right? Because it is. And so, but it's pretty much like, no, you can't do that. We don't work together that way. We don't work across. Well, we do now. So when COVID hit, you had 7 Bay Area public health, leaders come together and declare it an emergency and implement the first lockdown. And I give them a lot of credit. They saved a lot of lives in doing so, I believe. And so it's that kind of thing where I think we should take what we've learned in this crisis and understand we have other crises. And so we might want to think about, how we're doing crisis response bigger than just like my city has too many unsheltered people. No, this is bigger than that.
So you're calling for a regional strategy. I think, and I say this, like the current governor of California has been a friend of mine since '98. So I'm not saying anything out of, that he hasn't heard me privately talk about, but the only issue I have, doctor, is that, yeah, shelter in place is fantastic, but we didn't compensate businesses and people for doing it, And so it's made people crazy. Like a number of people that I know, and you may even be familiar with, if you go to some of the restaurants in downtown Oakland that have had to shut down, and, they've gone without money for months. And I know in a couple of cases, driven them literally crazy. And so they become part of the system that I hope you don't have to, they don't have to come across your path in that way, but it might happen. You know what I mean? That's
I
the only.
agree. I mean, I could sit here and tell you, I mean, it was January where I was like, why aren't we shutting the airport down? In February, like, why aren't we doing? I mean, honestly, if we probably would have locked everything down for a month or two and paid everybody to stay home, like
Yeah,
really paid them, like really
yeah,
paid them what they needed to stay home,
yeah.
we wouldn't be in this situation now. But really, I mean, really, capitalism and just there was a lot of decisions that were made more in favor, I think, of finances. But it was a miscalculation because look at where we are now. It was a miscalculation, a lot of miscalculations.
Uh, where, how many initiatives, because it seems like a lot, does Roots have that either are directly or indirectly related to COVID-19? Like, for example, there's Keep Oakland Housed, which you all have been involved in, I think, since October. Talk about your role in Keep Oakland Housed.
Yeah, we were asked to join in, really because of our roots in the community, and because we're continuing to we've actually grown since the pandemic hit. And so, you saw a lot of shifting happening when the pandemic hit. Some places closed their doors for a while, then started kind of reopening them. Some people closed down altogether, and not just because of the shutdown, right? Or some people just said, okay, we're going to close everything down, everyone work remote, we'll see our customers, our clients, whoever, later. But we never did that. We kept all our doors open, and we've grown. And so in doing that, it meant that we are just dealing with more people every day, who need who need something like Keep Oakland House. So I think it was out of that recognition that we were invited to be part of it. So sometime in late October, and it was something that really went through December 31st. So in that short time, we got out over $400,000 out into East Oakland to households who were behind on rent, and really will be at risk of losing their housing if at whatever point that happens. But so that, I mean, it's been tremendous. It's very life changing, the amount of stress that we're able to help sort of relieve for folks. And I think the amounts are usually somewhere around 3,000, 4,000. Don't quote me. But that has been a tremendous benefit. We also started Roots Community Fund, which is really for people who are working with us. They have a navigator with us, which is like a kind of like a coach or coach, someone who helps them navigate different systems. And we're able to get them access to funding support to help them. Maybe it's paying off utility bills, car note, phone bill, whatever the case might be. We built that in. It wasn't something we did a lot of before, but the need is just so huge that is something that we kind of committed ourselves to doing. And so basically, we do a lot of COVID testing. We do COVID vaccination. So we're very involved with the actual, COVID response piece, but all the other things that go along with it that have just been exacerbated, behavioral health, challenges, to your point, definitely have been exacerbated. We've had a lot more need showing up, I would say, there. And food insecurity, just all the things we worked on before are, amplified in a lot of ways.
So really, the whole of your company has been, in a sense, elevated because the pandemic touches on all of them. That's fair to say.
I would say that all the different things so it's a combination of things. The things that Roots does have been in response to all of the structural inequities that already exist, right? So we know that we had health disparities long before COVID-19 that we are there to address. And the way we address them is by learning what is causing them and really working as far upstream as we can. Although we're caring for people, obviously, very, downstream in terms of you already have illnesses and things like that. But we're also implementing a lot of solutions like our workforce enterprises that say, okay, how did we get here? What can we do to intervene? And so I think because we have workforce and we have, benefits enrollment, and we have navigation, and we have, all of these different things in addition to primary care and actually taking care of your health needs and your mental health needs. So all of those things we did before. Now that COVID has hit, I would say that it's just, first of all, COVID is of such an epic proportion, the scale, the number of cases, just the amount of devastation, that we did have to kind of early on say, it's not enough for us to just test Roots patients, right? Of course, we're going to test Roots patients. We started doing that in March, as soon as we could get our hands on some precious swabs and all that. But by end of April, we stood up the community site, right? Because we said, we got to step in here in a big way. We can't just keep it to our patients. We have a whole pandemic happening in our area. So what is our role going to be? So we stepped up, I would say, into a lot of this, out of just really a sense of urgency that if like no one's coming to save us, we have to do this. Like we have to step up and do this. And so, and then I would say, yes, we are called upon in a lot of different areas, but what we're also doing is partnering a lot. Like, hey, I don't want to be the whole food delivery thing for Oakland. Who else is doing this? Who can we partner with? So we have a lot of amazing partners, and some of the partnerships have formed since the crisis to really try to meet the needs. So there's a number of us, I think, out there that have stepped into this to say, look, we got to do our part. What can we do?
Is there, by the way, folks, if you're watching this and you want to ask a question, you can type it and it'll come up here. This is rootsclinic.org. That's the URL for the site. Hey, doctor, if someone's watching this and they need help with the services you provide, from getting vaccinated to renter's assistance, if that's also something else, how do they become an intake? How do they get into touch with you?
Yeah, I mean, it's pretty low barrier. So either showing up, at our sites. Our main site is 9925 East 14th or International Boulevard in East Oakland. And that is where we do, our pretty much all of our wraparound services. We also, our headquarters is where we have our pediatric practice and adult medicine as well. And that's at 73rd and MacArthur. And then we also run satellite sites like our mobile clinic that goes out into the different encampments. And most people who live, in East Oakland and are unsheltered, are familiar with our street medicine team. It's called STOMP, Street Team Outreach Medical Program. Then we also run 2 satellite sites at the youth shelters in downtown Oakland in the drop-in center. So young people also know where those are, Dreamcatcher and Covenant House, to drop in. Also, admin@rootsclinic.org. You can email that and basically will be routed to whatever service it is that you need. The phone number is 510-777-1177. And also we can route you to what it is that you need. The registration for testing is very simple. If you just go to the website, there's a big old red button that says COVID testing. And you can register. It takes about 2.5 minutes to register, something like that. And it's a walk-up testing site. You can just come and get tested. So that's very kind of low barrier access as well. With the vaccines right now, we are really, doing our best to make sure that our community gets the supply it needs. So we are right now vaccinating our patients and obviously our staff, as well as our partners and their networks. And we're doing that really by invitation, but within obviously the tiers that are set forth by the state and the county. But we really, we're very sort of keeping our eyes open to make sure that we continue to get the supply that's needed for East Oakland and Oakland in general.
If also you were saying something that caught my brain and made me want to ask, is there, because I talk and I try to read as much as I can within reason of my schedule, but I get the impression that there are a lot of organizations and people in Oakland that have their hands on this, but is there one meeting that everybody has to sort of put the puzzles, to see if all the pieces of the puzzle are being, put together, and then find the gaps and that sort of thing?
And this question is about COVID?
COVID related, yeah, because which also deals with housing and everything else, but yeah.
There have been a number of different kind of tables and coalitions, I feel like, that have formed through this. I would say the ones that, the mayor set up a task force early on around racial equity. It kind of has taken a little shift into a different structure. So we're kind of, in that process, but that was definitely an important space, I think, where city and county and organizations and residents and individuals kind of came together around COVID, especially ensuring equity. And that will become even more important now with the vaccine rollout. So I'm looking forward to seeing that kind of next iteration of it. There's also the African American Response Circle, which the Brotherhood of Elders has sort of convened and has been meeting, I mean, amazingly religiously for, 10, 11 months now, where we come together on a number of different issues, and we have committees. And from that, the committee that I co-chair is health. And from that, we've really kind of spun off a kind of a small group that's looking at why are there such large disparities in terms of deaths for African Americans in Alameda County, because it's almost double everybody else. Mm-hmm. And so we've been taking this very deep dive into the data with the public health department and a number of others participating in that. So that's been a very important space for me, because just getting our hands on data and being able to dive into it and try to see as best as we can what is going on in a very rapidly kind of evolving environment. And then I would say that there's a number of organizations that have started to pull together and work together more as well. And so, there's several of us that have really worked together on the ground to get messaging out about COVID testing, for example. Oakland Frontline Healers is the collaboration of a number of different organizations. The Black Cultural Zone is also a very important partner in terms of convening a number of different organizations and businesses. So those are the main ones that I would say we're very, very active in. And then there's some that are very topic specific, so it might be specifically around food equity and food justice. It might be specifically around workers, needs of workers and things like that. So there's a number of things that I think have been really spurred by this crisis and are working pretty well, actually.
It sounds like there needs to be one website that brings them all together. And I think that's
a great idea.
Open my big mouth.
Right. You just got this project.
What's that phone number for people, by the way? You said.
Sure. 510 777 1177.
Right here. And that is, whoops. There. And there. That's it. So in closing, Doctor, I want to thank you very much for this, and I'm doing this out of respect for your time because we could talk for a long time. Anything else that we should know about from the perspective of what services you're offering?
Well, I think that I would want to say that a lot of people have neglected their basic health and primary care needs during this time, and understandably so. But I just really want to urge everyone, we are seeing it's not just, COVID related deaths that have increased, but it's everything. And a lot of that is because people aren't just keeping up on their regular health needs. Behavioral health is the other one. We have to take care of ourselves. This isn't really we're going through kind of like a collective trauma as a world right now. Mm-hmm. And the amount of just information overload is very chaotic, and there are a lot of distractions, and it's just really, really important that we just get back to some basics. And so aside from protecting ourselves from getting COVID, because that is one of our most important jobs right now, is like, don't die of COVID, right? Like, don't die of COVID. That is actually really, really important that we don't forget that's actually a very high priority. But also, if you have high blood pressure, have you checked it? Have you checked in with your doctor? All of us are doing video and in person if that's what's needed. And so, or a phone call. I mean, sometimes, that can be a lifesaver just to talk through what's going on, make sure you have all your medications, refills, all of those kind of things. So I would just say, that we can get really distracted by all the things that are going on, but we got to really remember to take care of ourselves. Because I think a lot of us thought by now we'll be back doing X, Y, Z. We're not. And now it has been a really long time. So I just want people to kind of keep that in mind. And if you haven't had your blood pressure checked in years, maybe just go on and get it checked, or your blood sugar and some basic labs and those kind of things. So we're now really in the mode of like, the folks we haven't laid eyes on for a minute, we're calling you up.
Yeah. There's something else too. What strikes me about this is that we just had our second dose of the vaccine because Kaiser called my mom, who's 86, and I'm my mom's caregiver, and I'm keeping her company and, enjoying her great cooking and all that stuff and keeping my place on point, right? But no one ever says, hey, go to this website. Here are recipes
Mm.
fight the virus, right? Or like, for example, I discovered for myself a modern, well, let me put it another way. SARS-CoV-1, um, I found a kind of a mix of herbs that was approved by the FDA into a pill form in 2009. And I got those ingredients through Amazon. And I made a tea out of it
Mm.
and consumed that, right? And then hibiscus tea, which as it turns out, really helps you fight the virus. But my point is that unlike the common range of communicated homespun remedies, it seems like there's been a kibosh put on that. Can you what do we do to get around that? Because uh, people, it seems like they're being afraid or bullied into not sharing a home remedy that can just keep people safe. You know.
It has been a mad scramble. And so, and medicine, we're real particular about what we're going to call evidence and what we're going to say we have proof of. But also, I think all of us who are reasonable people will say if it's not hurting and it might help, then also go for it. But also, I mean, there have been numerous studies that are very promising for things like vitamin D, melatonin, vitamin C, zinc, things that are not considered pharmaceuticals per se. And those, I think, should be uplifted with all the caveats about don't overdose and all that kind of stuff. But I think they haven't gotten the attention they deserve simply because of this crazy mad scramble, that we've been in. And frankly, our laser focus on the vaccine, I'm afraid, is we're being shortchanged by that because we haven't really focused on therapeutics as much as I think we could. And at this point today, as we sit here, there really isn't any real outpatient treatment of COVID, which is crazy because we've got so many people who are getting it and we're basically telling them, supportive care, like, drink fluids and liquids and tea and what have you.
Those who may not know what outpatient treatment is, can you explain that? Because that's really
Sure.
Yeah.
So, I mean, and we're hearing this so much. We have so many cases of COVID, right? Well, people who are positive with COVID, there's nothing that I can write a prescription that they can take at home. So it really is, sort of these remedies you're talking about, which may or may not have been studied, but it would be nice if they were. And there's not, and some places, different parts of the world are doing different things, right? So there are places that are actually prescribing maybe steroids or other things. I'm not saying that's the right thing to do at all, because again, we need rigorous studies. But part of the reason why we don't have rigorous studies is because we have really pretty much put all our eggs in the vaccine basket, so to speak. So right now, the only treatment for COVID that you can get when you're not admitted to the hospital is what's called monoclonal antibodies. But those have to be given by IV infusion. And so there's not really places. So that's kind of what we've been talking about here lately is, do we need places in the community where you can go and get monoclonal antibody treatment? And it's only for a narrow group of people. So all that being said, we don't have enough. We don't have, like with HIV, there was this mad scramble. We need these antiretrovirals and things like that. We've never been able to come up with the vaccine, for HIV. So sort of a different animal, so to speak. But I think I'm hoping that now that we've got the vaccine candidates, 2 of them approved, others in the pipeline, that we will be, we got to stay ahead of the curve with the vaccine, make sure that they keep covering all the new variants that come if we can't squash this thing in time, right? Because we can squash it if enough people get vaccinated, if we stay ahead of it. If it stays ahead of us, like it has been for 11 months now, then we will stay in this situation. So that's the unfortunate, sad reality. But in the meantime, I think the fact that there could be interventions that could keep people out of the hospital, like monoclonal antibodies and maybe others that are yet to be fully studied. There's a number that look promising, a whole bunch of them. We just don't have anything right now. But if we could get to that point where getting COVID is not a possible death sentence, right? Where it's not like Russian roulette or whatever, or where you could really treat it from home and maybe not have to go to the hospital, that would be a huge game changer. And we don't have enough study there. And I think we all need to urge for that to happen like now.
Has the Biden administration, have you been connected with them yet? Or I know everything's still in the early stages, but has anyone talked about or putting together some local task force that communicates to them what's happening, or do you have a sense of what they're? I have a sense of what they're doing because I'm on the White House press list. My company is.
Nice.
But but.
Yeah, my sense is that with the, Coliseum vaccination site, which is now going to be run, by FEMA, that there certainly will, I think, be a lot of those, and I'm sure they already are happening. I just might not personally be involved with those, but I think I do think that there has certainly been between the federal government and here in our area, just by my knowing about that Coliseum project and that being a major undertaking that will be run by FEMA, there's definitely, conversation happening there. What all that entails, I don't know yet.
Folks, I'm going to get the hook. So before I get the hook, because those of you who are watching, this is already a video that you can roll back. It'll be a standalone video within 10 minutes of processing time. You can go back, get the information. There's 2 that you should be reminded of. admin@rootsclinic.org to reach out to Roots for assistance. You can also call 510-777-1177, and their main address for in-person intake, if I said that correctly, Doctor, 9925 East 14th, which we also call International Boulevard in Oakland. Hey, where'd you
call it that? Even y'all might call it that.
So East 14th. I know. Where'd you go to high school? Where'd you go to high school?
Skyline.
So did I. Wait a second.
Okay, small world. Hey.
Class of 80. How about you?
Nice. 89.
89, man. 9 years apart. How about that?
Wow.
Yeah, go Titans.
Yes.
We're all over. Hey, stick around the backstage, Doctor. Hey, everybody. Thank you very much. Subscribe to Zenny62 and bookmark oaklandnewsnow.com. Thank you, Doctor.
Thank you. Thanks for having me.
You got it.